Welcome to this broadcast of Corona Task Force, CBCA. We are here at Bethesda Hospital, one of the CBCA hospitals that has provided a place, an area where patients who have been suspected of having coronavirus isolated. We are going to talk to the medical director who will be explaining how the system will be working. As far as we have gotten information that they might be a suspected patient, isolated, because he had some signs of coronavirus. We will have more explanations from the doctor. We just say welcome to you all.
My names are Dr. Steve Kisembo. I'm the medical director of Bethesda Hospital, one of the CBCA healthcare facilities in the city of Goma, one of over 160 healthcare facilities of the Department of Health of CBCA. So, in this context of coronavirus disease, we are also organizing a minimum of activities to prepare ourselves just in case that we could have one case in this hospital. So actually this is what we're going to talk to you, show you a little bit what we are doing, and we hope that you'll be interested and you'll have a little bit time to listen to us and to see what we are up to. Thank you very much. So this is the main entrance of the hospital. Patients, relatives, or visitors are entering the hospital through this gate, and once they enter the gate, they get to this washing hands point here. So they get their hands washed from here, and then they proceed to the next checkpoint where temperature is being taken, and then they can proceed. But if it's the patient that comes in the hospital, he has to stay first here. So they go through the checklist to make sure that the person has no contact with epidemic region or area, or if he has contact with people suffering from coronavirus or not. So all these are being taken from this checkpoint. So they go through a number of questions that they respond to, and then if there's no doubt for the patient, then the patient can be taken either to the emergency service. Otherwise, they go for the outpatient department for their consultation. So, when the patient who has been isolated in this room is to be taken to the major center of the treatment for coronavirus these days, but previously we were using this area for Ebola patients. Then it's from this area, from this door you can see here, the patient will come out and get into the car, the ambulance that will take him to the treatment center. So women who are about to deliver and they are suspected to have either Ebola or coronavirus, we consider this room to be the room where they will they will be helped to deliver in the hospital setup. So this is the maternity bed that you can see here. It's the same bed that we have in a standard delivery room, and the list that we can need for a delivery room is here. We have electricity, and also we have some points for water just behind, and this is what we have considered for this purpose. So I can show you now the other room that is being used as an OT, just next to this room. So as you know, the cases of Ebola were not really reported in the city of Goma, and not even here in our hospital. This facility that we previously considered to be the facility for Ebola cases, suspected cases, actually now we are using the same facility to for patients who are suspected with coronavirus. We don't say that this is the place that we are treating coronavirus patients as such, but those who are suspected are being treated here. Meanwhile, their samples has been taken to the lab. So instead of looking at the patient, someone who's bleeding and needs operation right away, and he has signs of coronavirus, so this is the room where we believe we will be taking them for operation, either just to stabilize them, those who are bleeding, and then from here they can go into the other room that is at the entrance now to wait for the team to come and take the sample for the lab. So this is the operating room. So it's true, it can help us, but still we have too many things that we need as well, and I will show you maybe after, because this was previously built for Ebola purposes, but as we are facing another outbreak, that is coronavirus, I believe we will need to do a new setup to make sure that we are really facing the challenge with the basic need that we have. So this is the operating room. You can see we at least have everything. We have suction machines that are there. We have a concentrator of oxygen that is there also. And this is actually the basic that one can need in the operating room. We also have a monitor that is on the other corner. So at least the basic that we need in an operating room is there, and we can use it. So I can show you the rest of the room. This is actually the gate from which the surgeons are coming out, and the other gate, the door that is there in the corner, is from there that the surgeon gets in to the operating room or into delivery room. So this area you can see here is the area where the staff that has been in the operating room or in the delivery room, they come to undress here. So all that they used inside as their own dressings, they remove them from here, and there's another small exit point here where those who are in charge of all the instruments that were used, they come from here to pick and collect everything, either to go to drop in the pothole that is there, either they take it to the incinerator to incinerate all that they have used for the purpose. So this is the area where the surgeon and his team, they come to undress everything that they put on as they were operating. This is the room where we dedicated for patients who are suspected with coronavirus. So as I told you, there's one patient that has been admitted here right now. He's actually also suspected. So already we had called the epidemic alert center, and they came to take the sample. So as we are waiting for the result, we are attending to the patient here, as you can see in my left here. So doctor is there and one nurse attending to the patient as we are waiting for the result to come out, probably in 1 day or 2 days after. So meanwhile, we have something to do for the patient. That's why we have organized this place to attend to them as they are waiting for the result. And fortunately, he was alone in his room with other. That's normally they are with other patients. That's why we have decided to take him aside and put him here so that he can continue to with his treatment as we are waiting for the result to come out. So this is the room I was explaining, and the place you can see here communicate immediately with the isolation area of the hospital. So we are going to break the wall that's here and then put a door that communicates with the isolating area. So this is actually what we are planning to do in the coming days, and still we are looking forward to the support of the partners so that we be able to get ready for an outbreak in our area. So at least this is what we are doing, and I have a good team of doctors who are already taking their training accordingly. So we do believe that with God's support, if it happens to have so many cases here, at least we can face the challenge according to the list that we have. Thank you very much.
Ending this broadcast, we want to remind that the DRC registered up to this time 394 cases confirmed since the coronavirus entered in this country, and among them we have 48 recovered, 25 died of coronavirus, and 321 are the active cases up now. But let me mention that among the 5 cases that were reported in North Kivu, the governor of North Kivu have just announced right now, today, the 24th, that they have all recovered. So the remaining case that was reported in Beni is now declared recovered. Let us also mention that there was a reported case in Bunagana, Ruchuru territory. This is the border between Uganda and DRC. The case was reported negative. So the remaining suspicion is this of Bethesda Hospital, that we will be waiting for result to come from Kinshasa. Thank you for watching our broadcast and stay connected. We expect you in upcoming broadcasts of this CBCA Coronavirus Task Force. Thank you.